As the pandemic wears on, some hospitals face unique challenges.
In the last 2 months, one rural hospital has had no choice but to send a critical COVID patient out of state. There were no ICU beds available in Nebraska at that time.
KETV News Watch 7's Joey Safchik reports from Fairbury on what healthcare workers there are facing.
In the rural Nebraska town of Fairbury, doctors and nurses are in a relentless fight to keep COVID under control.
You know, I would say this round of COVID is probably 2 or 3 times as bad as the first rounds.
Jefferson Community Health and Life is a critical access hospital. That means they have fewer than 25 beds.
In terms of the pandemic, we have a lot less resources.
Most notably,
we do not have any ventilators in this facility.
So very sick patients have to be transferred to bigger hospitals in bigger cities.
We just don't have the same ability to do things as often as a larger hospital does.
But with less than 10% of adult ICU beds available statewide, patients who need transfers have the odds stacked against them.
Sometimes we're sitting on patients maybe 6 to 7 days.
Even earlier in the pandemic, it was easier to get patients where they needed to go.
The past month has been the worst it's ever been since I started working here.
But doctors like Brett Wergen and nurses like Aaron Stark care for those patients, even without ventilators at their disposal.
We have to just have somebody here to manually squeeze the bag to breathe for the patient.
When a patient here has to be intubated, that means a staff member, one of the hospital's most precious resources, has to be dedicated to breathing for them full time. Wergen fears the worst could still lie ahead.
It's just a matter of time before we get in a situation where we've got somebody hooked up to a bag, we're doing this, and maybe having to do that for hours. Gosh, I hope not days.
For several weeks, Jefferson Community has had an average of 3 inpatients with COVID. That could pose a problem because the hospital only has 5 negative pressure rooms where patients with infectious diseases like COVID can be isolated.
Every time we've had to transfer a patient to an ICU bed or a higher level of care, we're either having to wait for hours or we're having to hold on to them for days.
That struggle to find empty beds has doctors on edge.
Yeah, it's very stressful, and you just wonder how much longer you can put up with that kind of strain.
Not to mention the strain of combating misinformation in a county where only 50% of the population is fully vaccinated. 80 to 85% of people hospitalized with COVID at Jefferson Community are unvaccinated. Others are immunocompromised.
I can't think of an example off the top of my head of a fully vaccinated person that came in here so critical that we had to transfer.
But Nurse Starr is wary of the federal vaccine mandate. More than 90% of Jefferson Community staff is vaccinated, but Starr says hospitals are already short-staffed and can't afford to hemorrhage more workers.
To lose even 10 people would hurt us tremendously.
Dr. Wergen hopes healthcare workers trust the science.
Anything we can do to reduce the chances that we are going to spread, a deadly virus to someone else, we want to reduce that chances. And the best way to do that is to get vaccinated. So I want everybody who works here to be vaccinated.
As for the future,
the scariest thing would be that if once or twice a year we're having these big outbreaks of COVID throughout the state, where we're in the position we're in now where we can't transfer people.
With no cure for these struggles in sight, a call for Nebraskans to stay vigilant and get vaccinated.
So that we can feel comfortable here in rural America that if we get somebody who's really, really sick, who needs to have a critical care doctor and an ICU right away, we can get them there right away.
In Fairbury, Joey Safchik, KETV News Watch 7.